What signs and symptoms do you look for when you're assessing someone for ADHD? If you're an adult who suspects you have ADHD and you want to get assessed, where do you start? And are people with ADHD more promiscuous? These are just some of the questions I asked leading psychiatrist Dr. David McLaughlan in this week's episode. Watching the numbers go up really helps me avoid burnout and helps me keep producing better content for you all. If you find the content valuable, please click subscribe if you're watching on YouTube or follow on whatever podcast app you're listening to. Thanks so much and enjoy the episode. David.
Hello.
Thanks so much for coming on. I've been excited to have a psychiatrist on the show for a little while. How are you?
I'm really good. I'm really excited to be here and thank you for having me.
I think I'd love to start with a really, I suppose, simple question, but there are a lot of people who might see stuff about ADHD on the internet, or they might even have a diagnosis, and they might still be confused as to what ADHD actually is. Yeah. So I suppose a simple question is, what is ADHD?
Okay. It's a neurodevelopmental disorder. Although I don't really like to call it a disorder. I know I sometimes talk about it being just about a variation in the same way that some people are left-handed, some people are right-handed. But it's a neurodevelopmental difference, I suppose, in the way that our brains work. It's typically characterized by difficulty with attention, distractibility, as well as hyperactivity and impulsivity. With every person as well, it can present in different ways. And it's most often diagnosed in childhood, but we're seeing more and more people presenting later in life at the moment.
I've seen lots of conflicting stuff on social media about where it comes from, what causes it. I think the consensus seems to be that it's hereditary, but I've seen some narratives saying that it is a trauma response. So what's going on?
So most of the literature in the evidence, all the research studies would show that it's largely a biological condition. So there's a huge genetic. I'll start again. Your genes play a huge part in whether or not you have ADHD or not, and your genes will code for things like the dopamine receptors or the norepinephrine receptors, all the pathways which are responsible for ADHD. So by far and large, the biggest contributing factor to whether or not you have ADHD is your genetics. There's some other evidence that shows that things like low birth weight or being born premature, so being born before 36 weeks, also plays a large role in whether or not you would develop ADHD. But it's very biological. It's and the biggest factor is your genes.
Do you see it presenting differently in women to men sometimes?
Yes. So I work in the Priory Hospital in Roehampton, and before that, I was working in the NHS, and I worked in an adolescent clinic in the NHS, and most of my patients, when I was working in the adolescent clinic, were young teenage boys. And they were very often extremely hyperactive, very impulsive. And they were brought to the clinic because people found them difficult to teach, or the parents were finding them difficult to look after. So they were coming to the attention of me as a NHS psychiatrist because it was problematic for other people around them. What I find in my Priory clinic is that it's adult women that are coming to my attention, and it's because it's distressing and problematic for themselves, and they tend to not be so hyperactive or impulsive, but they have problems with inattentiveness and distractibility, and actually it can be enormously distressing for them, and they've lived with years or even decades of feeling like they're a failure or feeling like they're inadequate, that they're bad mothers, that they're bad at their job. And that's enormously distressing for them. And so it's often a real sense of relief or validation when they receive that diagnosis. There's three different subtypes of ADHD. There's ADHD, which is primarily hyperactive and impulsive. ADHD, which is primarily inattentive. And then there's a third type, which is the most common, which is the mixed subtype, where you have a mixture of both collections of symptoms. So yes, does it affect men and women differently? From my clinical observations, I've definitely seen different kind of populations of people with ADHD.
That's so interesting. And I'm thinking back, I was diagnosed with combined, and I never really related to a lot of the physical hyperactive stuff. I think back to my early years, and I was always kind of just sat in the classroom, pretty quiet. My school reports always said that I had potential, but I was always didn't get involved. But I had a racing mind all the time, constantly racing thoughts, thinking about often quite bad stuff, like the hyper focusing on negative thoughts. And interestingly, my psychiatrist who diagnosed me she asked me if I went to private school, and I said yes. And she said that she had seen it quite often in private schools. I don't know if you've got any experience of this, that because private school, for example, is so structured, that actually she sees a lot of patients coming in perhaps slightly later, because it wasn't picked up in that type of system. Do you think the fact that women perhaps internalize it, is that something chemical going on there, or do you think that's a societal expectation that women and girls should behave a certain way, so they feel a societal pressure to constrain their traits sometimes?
I definitely think that there's different expectations on boys versus girls. I grew up with three older sisters, and I think there was more allowances made for me being a boy, and I don't think that's right. I think that's obviously wrong. I think we should all genders should be treated equally. But there were certain behaviours that were permitted for me because I was a boy, and I do wonder if that's kind of true probably across a lot of people's experiences, where young boys running around, being hyperactive, climbing up the curtains, that's maybe it's less frowned upon, and I don't think that's right, but I think that's definitely true, that society has different expectations on girls versus boys. And I imagine that young girls growing up are aware of that, and so they probably do regulate themselves and self-monitor their behavior and have this desire to conform to what's expected of them. But hopefully that's something that's going to change. But I think you're totally on the money there.
Do you think that has a slight crossover with masking, and perhaps women and some boys who feel like they can't act out how they might naturally feel like doing because of this physical hyperactivity, so they internalize it, they act in a certain way that they think society deems acceptable for them? I mean, do you think that in itself is the definition of masking?
Yeah, I think the motivation for masking almost certainly comes from the societal expectations, this pressure. What do people want me to do or expect me to do? So then you have this desire to conform to it. But I think that's also one of the big reasons why people with ADHD often have anxiety, because they recognize that they're a bit different, and that they don't always conform, and they maybe self-monitor themselves. They're aware that they're perhaps a bit restless or fidgety, or that they sometimes say the wrong thing because the words come out of their mouth before they've thought about it. And knowing that you're different is actually really anxiety provoking, and especially when you're very self-aware of it. So I don't know, I think that's why it's really important that you have platforms like this that show people that, okay, yeah, you're different, but there's lots of people that are different. And, increasingly we're living in a world where it's more and more accepting, tolerant, even celebrating people for being different.
Yeah, no, absolutely. Do you see a equal split? I think you mentioned earlier the ratio of male to females who come to you. What does that look like?
again, so I used to see loads of teenage boys who would be really hyperactive and impulsive. But now what I'm seeing increasingly in my private clinic is parents, and actually often it's mums. Often the parents come to me because their children have received an NHS diagnosis, because it's easier for children. The waiting lists for children to get NHS diagnoses are much shorter.
Right.
But often the parents will see these behaviors in their children, and it's now getting this diagnosis of ADHD, and the parents see this and they think, hang on a minute, this is exactly what I was like. I do all of these things. Oh, and this is actually the symptoms of ADHD. Well, this is, I can relate to all of this. But predominantly it's the mums that are coming to me, and they're predominantly coming with the inattentive symptoms and the difficulty with concentration, and all of the other things like that are secondary to that, like maybe running late for things, time blindness, losing items. But also it's the other thing as well is they're not just coming to clinic because they're a little bit forgetful and not packing their children's packed lunch boxes. It's the distress that comes secondary to that, and the feeling that they're a failure. That's normally what drives them to come and see me. I've
spoken to a lot of parents on this podcast, and there was one particular woman who was phenomenal, and she said the main stress for her was she often forgot to do things that were actually fundamental in the safety of her children. For example, something silly like she had a gate in her garden which she sometimes forgot to lock, and that was immediately blocking the grass where her child plays to the road, like outside her house. And it was that kind of, one day her husband came home and he realized she hadn't locked it, and that guilt and that shame of what could have happened and it was that which took her to get assessed. So absolutely in line with what you were saying, that sort of secondary. For people who are looking to go and get assessed for ADHD, they'll come to see someone like yourself. What does the ADHD assessment process look like?
Yep. So normally what I would do is I would send them out some pre-assessment questionnaires, forms beforehand. And I would also ask them if they can send me any other relevant medical records from their GP or any other psychiatrist that they've seen before. And then I'll have a read through the pre-assessment questionnaires before I meet them. And that sometimes gives me kind of a sense of what's going on. But every time I meet somebody, I always meet them with a totally open mind, because there's lots of things that can look like ADHD that aren't ADHD. So then when I meet somebody in clinic, I usually just sit and listen to them and give them that chance to tell me their story. I think there's a real value in making somebody feel listened to and heard, and to validate their experience. And I think that's really, really important to do right from the very beginning, to validate that what somebody is telling you is true, and that you believe them, and that they deserve to have a really good assessment, but also to get the right diagnosis so that they can get the right treatment. And sometimes that results in somebody getting a diagnosis of ADHD, but other times we might find that there is a much better explanation for what you've been experiencing.
What other conditions look similar to ADHD then, that someone might think they have ADHD, they come and see you and you say, actually, you've got, what other conditions might they have?
Yeah, I would say about 10% of the people that come to see me in clinic who suspect that they've got a diagnosis of ADHD actually have another diagnosis called emotionally unstable personality disorder, or sometimes called borderline personality disorder. And it looks really similar. There's a huge overlap with symptoms like the impulsivity or emotional dysregulation or rejection, sensitivity, dysphoria, which I know is something that's commonly experienced by people with ADHD. And although they look quite similar, the treatment pathways are very, very different. And it's a bit like, if I can use a less palatable kind of analogy, but diarrhea.
Okay.
I'm going there with diarrhea.
Yeah.
Diarrhea is also really inconvenient. But there's lots of things that can cause diarrhea. It could be Crohn's disease, it could be ulcerative colitis, it could be celiacs, it could be IBS, it could be
a trip to India.
It could be a dodgy curry. So there's lots of things that can cause diarrhea. It looks very similar. And so what I ask somebody to be really open-minded with is when they come in to, this might be ADHD, but regardless, I'm here to listen, and we'll explore this together with an open mind, and let's figure out what the cause of this is. And if we can get the right diagnosis, we can get the right treatment.
So when you're assessing someone for ADHD, are there any specific signs or symptoms that you're looking for?
Yeah. So there's two diagnostic criteria categories we use: ICD-10, DSM-4, and so you have to have a certain number of symptoms or presentations across the three different domains. So impulsivity, hyperactivity, but also inattentiveness. Those symptoms need to have been present from childhood, so typically before the age of 12, and also typically in multiple different environments. So not just at school, not just at home, but seeing that constellation of symptoms in multiple different environments. And the other thing that we need to do as well is we need to exclude any other more likely diagnosis. And that's really important because you want to get somebody the right diagnosis so you can give them the right treatment.
Apart from the borderline personality disorder, are there any others that could be confused with ADHD?
Yeah, absolutely. So I've met people who have told me, I'm really restless, I'm really fidgety, and when I'm in a board meeting, I can't stop moving, and I'm sweating, and I'm fiddling with my pen, and I've got racing thoughts. And then I listen to them, and then I ask them, well, how are you when you're at home, when you're watching a film? And they'll say, yeah, absolutely fine. And so that's an example where this is maybe somebody who's got social anxiety, and they are really restless, they are really fidgety, and they do have racing thoughts, but it's because of social anxiety. And so that person might need cognitive behavioral therapy, or they might need SSRI, which is a type of antidepressant, but it's not ADHD, it's social anxiety. The other thing actually I see as well is people who have very low self-esteem and incredibly self-critical, and they might be low in mood and depressed. But when you're low in mood and depressed, you also may have difficulty with concentrating, and you can even get something called pseudo-dementia, which is where you have such significant problems with concentration and memory that it causes cognitive deficits. So again, that's the other diagnosis that I would want to exclude, to make sure that somebody is not depressed, they're not anxious, and that they don't need a different treatment pathway.
It's fascinating. Do you think ADHD should be labelled as a disorder?
I don't personally. I think that there's people who live in the world with us. I'll start that again. Do I think that ADHD should be labelled as a disorder? That's maybe a question that's best answered by people with ADHD themselves. I think that I look at ADHD as a variation, and that some people have ADHD, some people don't, some people have autistic spectrum or on the autistic spectrum, some people aren't. But for me, it's a bit like if you're right-handed or left-handed. And if you're left-handed and the world is designed for right-handed people, it can sometimes be jarring and distressing. And it might be more difficult for you to maybe use a right-handed pair of scissors if you're left-handed. But being left-handed isn't a disorder, it's not a disease. It's just that it's difficult if the world around you is designed for right-handed people. And I do think that's the same for people who are neurodivergent. You might have ADHD or you might have autism, but I don't view that as a disorder or a disease. It's just that you're different, and the world around you is designed for the majority, and you're divergent. You're part of a minority of group of people.
I think there'll be a lot of people listening who wish that they could tell their younger versions of themselves what you just said.
Yeah, but I caveat that, or I balance that with the recognition that actually it can still be really distressing. And that's why I was a bit hesitant, because I know that there's people who've got ADHD, and it's really crippling for them, and it's distressing, and they wish that they didn't have it. And those are the ones that often come looking for treatment or looking for medication. And sometimes, you hear this phrase about having ADHD or having autism being like a superpower. But actually, I don't know if that's always helpful for people who do find it distressing. And it can almost be a little bit patronizing, I think, because it doesn't recognize how difficult it can be to have ADHD or to be on the autistic spectrum.
I agree so much. And I would always stop short of calling it a superpower, because I think that it's enabled me in some areas of my life. And I think with self-awareness, I think anyone with ADHD can find out the strengths and lean into them. But until you've got that self-awareness and you perhaps are still figuring out how to mitigate the downsides, it was definitely not a superpower for me and for many people for a lot of the time. I think if you're in that stage and you hear someone say it's a superpower, you can then think, well, not only do I have ADHD, I've got the shit version of it, which can be really detrimental.
Yeah, well, like, puts you under pressure. I mean, imagine getting a diagnosis of autism, then feeling this burden. You then have to deliver some sort of, I don't know, you've got some responsibility to the world.
Yeah. Like if an autism diagnosis, and then assuming everyone must think you're great at maths because of, I imagine, the stereotype that a lot of people, because of representation.
Yeah. Yeah, you said something actually which I think is really great. Actually, you talked about self-awareness, and this is why I do think that platforms like this they're amazing, because you provide a mirror to allow people to look at other people with ADHD, and also maybe recognize some of those traits in themselves, and to gain that self-awareness. And although people come to see me in clinic from a medical perspective, and they're maybe looking for medication, I think a lot of the time what they really get is the validation, but also some sense of self-awareness. And then they're much more able to regulate themselves and check on themselves and realize, hang on a minute, this is a really good example of me being impulsive right now. Maybe I shouldn't do this. Or this is one of the traits like that I'm acting out, like talking over somebody because of my impulsivity. And I can have that self-awareness and regulate myself a bit better.
You mentioned earlier about ADHD treatment. So if someone comes to you, you assess them, you give them a diagnosis of ADHD, what would be the next steps in terms of treatment options for someone like that?
So I'd always follow the National Institute of Clinical Excellence guidelines, or for short, the NICE guidelines. And what that tells us to do is to obviously do a really thorough examination, take a history, exclude any other more likely diagnoses. But if you are going to go down the treatment pathway for ADHD, the gold standard of treatment is with a stimulant medication, something like methylphenidate. Typically, I would prescribe my adult patients a long-acting methylphenidate, which might give them the benefit of medication for up to about 10, 12 hours. And that's usually the most effective treatment for people. About 70% of people will respond to methylphenidate. Sometimes you have to go with another stimulant medication, like lisdexamfetamine. And then if stimulants aren't effective, then you might want to consider maybe a third-line treatment with a non-stimulant medication. But it's different for every single person. And of course, throughout that whole process, you're counseling the individual about the side effects that they might experience. So common side effects with the stimulants are loss of appetite. Your blood pressure can go up. So that's something that we have to monitor carefully. And start you on a low dose of medication and titrate it upwards. My goal is always to get patients on the lowest effective dose that works for them. But there's other less common side effects that are still worth mentioning, things like insomnia, blurred vision, dry mouth. But I always try and give people as much information as I can, or as much information that is that's going to be useful to them, and work collaboratively and find the right treatment pathway for the individual. And it doesn't always involve medication. It's other things like coaching, or sometimes just, like you say, self-awareness, and understanding yourself. And that validation, that's enough for a lot of people.
I wanted to touch upon a topic that is quite close to me, and I think is close to you as well. And I know that it's close to a lot of people in the community, and that's the link between ADHD and addiction. Just from my observation of speaking to many people and going to meetings for alcohol addiction, there seems to be a link between ADHD and addiction. So is that something you've noticed? And is there an explanation as to what's going on there?
Yeah, definitely. So again, I do a lot of alcohol detoxes, and I've also treated people in inpatient rehab services for things like cocaine addiction, and I have had lots and lots of people who've come in to see me initially because of their addiction, and I meet them in clinic, or I see them in detox or the rehab unit, and I think, oh my gosh, this person's got undiagnosed ADHD. And this is, again, it's anecdotal data, but what I've seen is when we've treated them for their ADHD, their substance misuse, cocaine misuse, alcohol misuse has all decreased. I think often people with ADHD, they maybe self-medicate. So if they're struggling to fall asleep at nighttime, they might start drinking heavily. The other thing that I've seen anecdotally is really interesting is people with ADHD telling me that cocaine has a almost paradoxical effect, the opposite of what you'd expect it to do for them. And they describe it as calming them and helping their thoughts to be clearer and more linear. I would absolutely advocate for people not to do cocaine. It's a horribly expensive habit and really bad for your health. Please do try and get an ADHD assessment and treatment. But yeah, clinically, I definitely have seen a huge overlap with people who've got ADHD and addiction. You also asked me, why is there this overlap between people who have addiction and ADHD? And the reasons, I imagine, are incredibly complex. But people who have ADHD often have a deficit of dopamine in their prefrontal cortex. And that makes it difficult to regulate their emotions or to act out executive functions. But also dopamine and another neurotransmitter called norepinephrine are also heavily involved in the pathophysiology of addiction. So if you have dysregulation of those two neurotransmitters in ADHD, there's also a good chance that you've got dysregulation of those two neurotransmitters in which would predispose you to have becoming addicted to different substances, including alcohol or cocaine.
Gosh, yeah, no, it's fascinating. I think there'll be many people listening who will recognize that, especially the self-medication part. I think for me, it was always, how can I turn the volume down in my head? Like alcohol did that for me. And from speaking to other people as well, I've heard a lot of people say that it's that self-medication. They've figured out that alcohol is potentially the solution to their racing mind. And then when they perhaps start drinking, they just get this huge relaxation, actually, rather than traditionally you might get a buzz. They actually go the other way, and it almost becomes they crave more and more of that. Do you think people with ADHD generally perhaps are more susceptible to hedonistic behavior?
So yeah, so one of the key features of ADHD is impulsivity. So again, it's because of the differences in their prefrontal cortex. Your prefrontal cortex should be helping you to make really good decisions, weighing up the pros and the cons, looking for the evidence that this is a good idea versus the bad idea, and regulating that part of your brain that says, the limbic system that says, hey, this looks like fun, let's do this. The emotional epicenter of your brain, the limbic system, where emotions like anger, lust are generated from, and our prefrontal cortex should regulate that. People who've got ADHD, they've been described before as having a Ferrari brain, but bicycle brakes. And so they often rush into making decisions very quickly. But that could be a decision to do something hedonistic, like taking substances or drugs, alcohol, or engaging in risky sexual behavior, or any sexual behavior, risky or not. But they tend to rush into decisions, and it's because of that impulsivity, which is a key feature of ADHD.
Oh, it makes sense. Again, observationally, do you think people with ADHD are perhaps, on average, more promiscuous?
That's a really difficult question to answer. I don't have the epidemiological data in front of me. Are they more promiscuous? It's definitely something that I ask about in clinic. I ask people about different risks, and one of the risks is about exploitation or risk of harm through misadventure, and that could be exposure to sexually transmitted diseases, unwanted pregnancies. Is it something I've seen in clinic? I've definitely had patients in clinic who've told me, yeah, I've done some things that I regret, anecdotally, I've definitely seen it, but I don't have the epidemiological data in front of me. But it's definitely something I ask about. Yeah.
There's one thing I wanted to ask, and is this such a big topic amongst the community, and it seems to be, it's been labeled as rejection sensitive dysphoria. It's this like intense reaction to rejection or criticism, or even a perceived criticism. Someone might say the slightest thing and you can almost boil over in rage and you lose rationale. So is that something have your patients brought that up in clinic, and what's going on with that? Is there an explanation as to what causes rejection sensitive dysphoria?
They don't always bring it up, and they certainly don't always use those exact words or terminology, rejection sensitivity dysphoria, but they describe it, or I sometimes see it myself. And I watch patients in the way that they react or respond with receptionists, and even the way that they maybe talk to their partner if they've come into clinic with their partner, or their partner might describe that to me. And it's really, really interesting actually, because people who have this other diagnosis, the alternative diagnosis, which is emotionally unstable personality disorder or borderline personality, they often are really, really hypersensitive to rejection or criticism. And that's because of a difference in the neurobiology of their brains. But I suppose it's understandable that if somebody is neurodivergent and they have ADHD or autism, if they've grown up being a little bit different, society's not always kind. Other school children might be mean to you because you're a bit different. And you may have experienced very real rejection, or you may have been ostracized because you are neurodivergent. And I think that rejection does prime people, and it primes them to be more vigilant when it's going to happen again. And it's painful. It hurts. It hurts when people are unkind to you or reject you. So it's definitely something that I've had people describe and tell me about. But it also makes me curious to see could this be the rejection sensitivity that's commonly seen in another diagnosis? I
saw a statistic that sort of leans into what you were just saying, that perhaps neurodivergent people are exposed to so many thousand more negative comments in their childhood because they're acting slightly different than their classmates, or even maybe from their teachers or their friends, because they're exposed to so much more criticism or even slight remarks at school that builds up and compounds. And when they, in their adulthood, then they're so responsive to the slightest criticism, because it's kind of, and the reaction perhaps is that they just don't want to go anywhere near it because they had so much of it as a child. Do you think that's similar to it? Do you think that theory holds much weight?
Yeah, absolutely. I think it's, what's that expression? Once bitten, twice shy. And I think if you have experienced social rejection, or you've been ostracized, or rejected, I think it must condition people, it must prime them to maybe anticipate the same thing happen again. And then if they anticipate it, then maybe avoiding it or taking measures to prevent it from happening. So yeah, I absolutely think there's truth in what you've said.
Just focusing on, because again, it's a comment that I see a lot from my community, and that's grief. And do you think people with ADHD are more susceptible to having a worse experience when it comes to grieving? So
I thought, because I watched one of your earlier podcasts and you talked about the grief of when you receive a diagnosis of ADHD and realizing that there's been so many things in your life that you've lost because of the ADHD, like perhaps lost education opportunities or work opportunities or relationships that have been damaged. So I definitely think that when people receive a diagnosis of ADHD, they maybe have this sense of grief or loss. But usually it's countered with a sense of relief, an understanding of why their life has been the way it has been, and also that kind of sense of validation, which usually is more beneficial than that sense of grief. I think people with No,
that's perfect. I think you hit the nail on the head. I think if you get a diagnosis slightly later on, you might be quite upset about perhaps the life that could have been, or the opportunities that might not have been passed up, or the relationships that might have lasted longer, or the job that you might have not left if you knew that you needed to ask for some simple accommodations in the workplace, for example. And all of that can compound into quite a grieving process for the person who gets that late diagnosis. I suppose it's what's the average age of the patients that you see in your clinic?
All different ages. I'm a general adult psychiatrist with a special interest in ADHD and addiction, and I have endorsement from the Royal College of Psychiatrists in general adult psychiatry and also addiction psychiatry. But because of that, I tend to see people from aged 18 and upwards. When I was doing my training, I did train in child and adolescent mental health services as well. But right now, I look after people aged 18 and upwards. And I often see people who are at the end of their secondary education, about to go to university, and they're often brought by their parents who are anxious about their 18-year-old son or daughter doing well at school. And then I see the other population, which is the parents whose children have received a diagnosis. But there's one of my colleagues at work, and he's recently treated a 72-year-old who has been diagnosed with ADHD at the age of 72. So, but just I'm keen to point out as well, this isn't something that's suddenly developed at the age of 82. It's been something that's been undiagnosed for this whole period. ADHD doesn't. It can't be an acquired illness. It's not something that suddenly develops. It's something that you have your whole life.
You just made me think, if there's a big, catastrophic, stressful global event like a pandemic or a stock market crash or something that causes mass panic, and that perhaps incite ADHD traits in someone at a particular point in their life. So if you have suddenly, it leans on from what you just said, if you start experiencing ADHD traits at a point later on in your life, then it's probably not ADHD, because you have to have ADHD throughout your whole life. So can some of the traits of ADHD almost be a response to stress triggered by a huge global event, or more of even a local event in someone's life?
I don't think it would be a response to the stressful event, but there's definitely times where some of my patients will notice their ADHD symptoms, and that's usually because of what's demanded of them from their environment. So, for example, if you were a professional skydiver, ADHD might not be a problem for you. But then if you suddenly change careers and you had to be an accountant, your ADHD symptoms may now start to cause you problems and be distressing. And so you want to seek help. But you haven't actually inherently changed as a person. It's environment around you and what that environment around you demands of you that has changed. But those symptoms, those traits, those qualities that give you that diagnosis of ADHD must have been present previously. It's not an acquired illness that suddenly develops.
We've seen a surge in ADHD content on social media, and it's a reasonable explanation as to why many people are becoming aware and seeking an assessment. What do you think of some of the ADHD social media content, and do you think that there's perhaps a risk of misinformation with some content creators putting out content? Yeah,
absolutely. I mean, I think social media is a phenomenal way to disseminate knowledge and to teach people about ADHD. And in general, actually, I think it does a really great job. It's really empowering, and it helps people to gain that sense of self-awareness, which is really useful. And there's definitely a need for it, because NHS waiting times are far too long for ADHD assessments, and private clinics are far too expensive for most people to get access to that kind of knowledge and information. A lot of the content is really entertaining, and it's incredibly relatable, and that's why it goes viral. But there was a study published about a year or so ago, which showed that about 50% of the social media content about ADHD was actually inaccurate. And about half, and it contained misinformation. And one of the common sources of misinformation or inaccuracies was content creators who were sharing their very personal experience, but they were sharing it in a way that was overgeneralizing it, as if it was going to be true for everybody, but it wasn't. So there was that kind of sense of overgeneralization. So yeah, it's one of my kind of pet peeves with social media. There's really no verification about the quality of medical information, clinical information that's being disseminated. But overall, I actually think it does I think it's a really good thing that it exists. I would just say to people, watch this content, but also take it with a pinch of salt, and also, get information from other really reliable sources like the Royal College of Psychiatrists, charities that support people with ADHD, or mental health charities like Mind. And if you can, see a psychiatrist.
I'll put the links to those sources in the show notes. I've got a couple of questions just to finish off from the community. Everyone was very excited when I said I was bringing on a psychiatrist.
Oh, good.
To the show. Just three. Well, I know there were about 150, but
okay.
we don't have time. So the first one is a very blunt one, I suppose, is, do you think ADHD is overdiagnosed?
Ooh. That's a really difficult one to answer. Is it overdiagnosed now, or has it been underdiagnosed in the past? I honestly don't know. I think time will tell. I imagine there's going to be clever epidemiologists. I imagine in the future there'll be epidemiologists. Why can't I speak today? I imagine there'll be epidemiologists in the future who will do longitudinal studies and find the answer for us. Is it overdiagnosed now, or has it been underdiagnosed in the past? I don't know.
Maybe we're just seeing a correction of like loads of women and men that weren't aware, and now they're suddenly, and then everyone's just flooding in at the same time.
Yeah. I think the world that we live in just now is different. And I think there are more distractions in the world that we live in. There's more things that compete for our attention, especially our phones. And that hasn't existed before. But whether our genes, whether our neurobiology has always conditioned us to being distractible. But just now it's manifesting as a problem because of the distracting technology around us. That's something I do wonder about. But the important thing is, to listen to people who come in and tell you that they're struggling, and for me not to get too distracted about whether it's being overdiagnosed now or underdiagnosed in the past. But the critical thing for me actually is to listen, to see the person in front of me, listen to them, and be open-minded and treat them like an individual.
Thank you, David. Next question. I'm scared I'll be dismissed by my GP. How do I start the conversation?
Okay, I think tell your GP exactly what you're experiencing in the language and the words that feel most natural to you. And one of I suppose I'd be curious about why this person is worried about being dismissed. But my advice would be just tell your GP in the words and the language that feel most natural to you. Lots of my friends are GPs. They really want to help. They're sometimes a bit overstretched. But people become doctors because they don't do it for money. they don't do it for the sociable hours. They generally do medicine because they're really interested in science and they love people and they want to help.
I think, just to add some colour to that, I think just from the narrative that I've seen, I think that might be alluding to some people think that, and perhaps it's an older generation of GPs, maybe roll their eyes a bit when someone comes in and say they think they've got ADHD because, you've just seen something on social media, don't be silly. Or maybe they don't even, slightly older generation of GPs might not even believe that it's a real thing. I think that's what she's alluding to add a bit of colour to that comment. So I suppose, just going off tangent a bit, is that something you are aware of? Some GPs who just aren't on board with neurodiversity or ADHD being a thing?
Yeah, quite. I imagine there are. Hopefully, a small minority, hopefully a tiny minority of doctors who have a limited understanding of neurodiversity. Certainly, when I was at medical school 20 years ago now, which is horrifying to say that, but when I was at medical school 20 years ago, I think I had a half-hour lecture on ADHD and autism. And general practitioners, GPs, have to do an enormous number of things and look after. They have to be generalists, right? So they're really good at lots of different things. So they're not going to be experts in neurodiversity or ADHD or autism. But they are experts in general practice. So I wouldn't give them too hard a time. It might be that you even need to educate your GP. I always describe myself as, I don't describe myself. Some people would describe me as an expert by education, but people with ADHD are experts by experience. So you might need to also educate your GP. And point them towards the different resources and sources that you found.
Great advice. Just finally, David, thank you very much. I'm an adult and I suspect I have ADHD. I want to seek an assessment. Where do I start?
Okay. You should go to your GP as a first. Okay, so if you're an adult and you suspect that you've got ADHD, speak to your GP as first protocol. Describe what it is you're experiencing, the symptoms that you're experiencing, and they will likely direct you towards an NHS adult ADHD service to get you an assessment. Waiting list times vary. Sometimes it can be really quite long. It can be 2 years in different parts of the country. There are a number of private clinics that offer ADHD assessments. I work in the Priory Hospital in Roehampton. This isn't a plug for them, but I know that we have lots of really good consultants and kind of world experts. And it's really great. I feel really privileged to get to work in that kind of environment. I'm also really aware it's just expensive, and it's not affordable for a lot of people. And I think before you go and pay for a private ADHD assessment, it is probably worthwhile speaking to your NHS GP, looking at information online, being open-minded that maybe this isn't ADHD. There's lots of other things that it could be. But those are the two routes, I suppose, for an NHS assessment, going via your GP. And if that's just too long, then getting a private assessment.
I might be misguided. Is there something called right to choose, which is where essentially the government taxpayer pays for someone's private assessment?
There's oh gosh, I actually don't know an awful lot about this scheme, but I'm aware of a scheme called the right to choose. And that means that the patient has some degree of autonomy in terms of where they receive their treatment. I don't know much more about it than that, if I'm totally honest. And I don't know if that means that you can perhaps you can receive your assessment in different parts of the country. I'm not well enough informed to give a reliable answer, but it's something to look into and ask your GP about. Ask your GP about the right to choose scheme, because they'll be best placed to tell you.
Cool. Gosh, David, I've learned a huge amount in the last hour talking to you, and I'm sure everyone else has as well. Thank you so much for your time today, and thanks for coming down to London.
Yeah, no, thank you for having me. Yes, it's great to meet you as well. And I've had fun too. So thank you.
Amazing. Thanks so much.
Cheers.